Hi, my name is Dr. Arezu Azarani, and together with my husband, Dr. Ayari, who's a board certified geriatrician, we have a geriatric clinic in the Bay Area, California. Today, I want to talk about my own history and bring into your attention a few medical conditions that are terribly important to follow up on and check. So, ever since I was born, I had a lot of health issues. When I was in my early teens, I was diagnosed with juvenile rheumatoid arthritis. And then before the age of 18, I was diagnosed by ulcerative colitis. And these are all complex names, but in short, what it meant is that I had a lot of joint problems. All my joint, including my shoulders, my knees, my neck, my spine, my back, everything was hurting, especially when I exercised or when I put a lot of tension on my body. And as I mentioned to you, I also had a lot of GI problems. I had a lot of bleeding from my large intestine, so that is ulcerative colitis. And it occupied a majority part of my large colon. I had a lot of acid reflux, so I was also diagnosed by GERD. Again, another fancy name to say that. I had a lot of acid that was produced in my stomach, and because there was no valve to stop it from coming into my esophagus and mouth, I always had heartburn. And then in my 20s, I was diagnosed with endometriosis, and I had 25 surgeries ever since. Severe pain, abdominal pain, very painful periods. And then eventually throughout my life, it translated into interstitial cystitis, which is the ulcer of my bladder. And it continued throughout my whole life with different manifestation. Again, the majority of the problem was pain everywhere. My GI, I could not eat anything. I could not eat any fruits, even juices, anything with fiber. The only thing that I could include in my diet was rice and meat, very lean meat. I also could not eat any gluten. I became allergic to a lot of things while I was in my early teens. I was allergic to peanut butter. I was anaphylactic, which meant that if I ate it, I would stop breathing, and I needed an EpiPen. But later on, as I got older, I developed all these other allergies, everything such as gluten, dairy, soy, spices, everything in terms of hygienic products such as soap, shampoos, you name it, I had allergies to it. And at some point in my life, in my early 40s, I started having severe vertigo and dizziness, which would go on for 24/7. So everything was turning. I was very miserable. I could not eat anything. I was weighing at my worst about 48 kilos. And to make the long story short, I was always going to doctors. I was always seeking help. My early life, I was raised in Canada, so I was seeking doctors in Montreal, Canada. And then when I came to California in the US, I was going to all the big centers, such as Stanford. I was part of Stanford myself. I did my education at Stanford. I was seeking help for all these problems, and I was going to different doctors. And each time my primary cares would send me to, for example, GI specialist or neurologist or ENT, because the first thing that you say when you say I'm dizzy, they always send you to ENT. They would run all these expensive tests. For my joint pain, I saw a rheumatologist. They would send me for a lot of physical therapy. I went through years and years and years of physical therapy. Even though I have a scientific background, because I was so desperate, I also tried many other Western medicine procedures such as, acupuncture. I tried herbal remedies, you name it. I just tried everything, and everything was making me sicker and sicker. At some point, I just could not function anymore. I had a hysterectomy, I had ovarectomy. One of the doctors that I saw a lot of rheumatologists. One of them told me that I might have lupus or fibromyalgia. Fibromyalgia is basically when nobody knows what is going on with you, but you have pain all over. So they just diagnose you with fibromyalgia. They told me I have lupus. They put me on lupus treatment, which actually made me worse, to the point that about maybe 4 years ago, I was almost dying. I was diagnosed with Hashimoto disease, which is that my thyroid was being under attack by my immune system. I also had severe headaches in addition to the vertigo and dizziness. I was losing my balance. I could not walk straight. I keep falling down. And again, neurologist kept sending me to ENT to neurologist. Nobody knew what was wrong with me. Everybody was saying maybe it is in my head. I should take antidepressants. It was the same thing when I had my endometriosis. And because at those days it was not very known, everybody's telling me that it is maybe my imagination, which I hated. But because of my background, I kept insisting that no, it was not an imaginary disease, and I was really suffering from something major. To make the long story short, when I was almost on my deathbed, I finally saw a rheumatologist who put me on Humira, which is a human antibody, basically with the diagnosis of seronegative arthropathy, meaning that I had an autoimmune disease, but it was not always showing numbers in my blood, markers that relate or are normally used to diagnose autoimmune disease. And by putting me on that, which is an injection called Humira, massive amount of cortisone, I started feeling about 50% better. But unfortunately, after about 6 months of this therapy, because it's a human monoclonal antibody, my body started making antibodies against the medication, and so it stopped working. And I finally ended up with a very famous doctor head of the rheumatology department at Harvard. And he is my savior. He finally diagnosed me that I definitely did have autoimmune disease and put me on a medication called Rinvoq. And I'm not going to go into the details of how this works, but it's not a biologic, so it's not a human monoclonal antibody. But what it does is that it basically silences my immune system, and my immune system that has now attacked my mastoid on the left side, my GI all over, small and large bowel, my intestine. My kidneys are stage 3. They are irreversible. Unfortunately, my thyroid has been attacked. My joints are very, very painful. My problem decreased by about 90%, and he saved my life. And I am here today to let you know that if you suffer from any of these diseases like fibromyalgia, they tell you it's your imagination, or dizziness. At some point, I saw this ENT/neurologist that is very famous. I'm not going to name her. But she diagnosed me with this bogus diagnosis called PPPD. Be aware. If anybody diagnoses you with these things and puts you on vestibular therapy for years that don't work, there is something wrong. And I heard later on, and I found out through research, that a PPPD diagnosis is just bogus. There is no such diagnosis. If it's just like fibromyalgia. If they don't know what is wrong with you, they just diagnose you with that. And I also was stupid enough to pay a lot of money to somebody in Australia who claimed herself to be an excellent therapist for helping you get rid of your PPPD, vertigo, dizziness, which was totally bogus. She just charges you, and there is no truth in it. She kept blaming me, telling me every time I told her that I'm getting sicker and I'm not seeing actions, that it was my fault, that I was not following the instructions, and it was totally up to me to make me better. I should have known better, but I fell for it. So in this video, I just want to bring to your attention that if you are suffering from any of the things that I mentioned to you and keep going from one doctor to the other and you're not getting answers, not to give up. You might have autoimmune disease. Keep checking with different rheumatologists. Unfortunately, there are not that many rheumatologists, especially really great ones, but they are out there. I've seen rheumatologists, as I mentioned to you, at Harvard universities, and I got excellent results. I also saw people, rheumatologists at UC San Diego, UCLA. They were excellent. There was a rheumatologist at Stanford who started me on Humira. She was very good. She's no longer there. But just don't give up. I tried Mayo Clinic. I sent my history for them, but they wouldn't see me. They said I'm too complex to even bother seeing me. But my thanks is all to all the physicians who are out there trying their best to diagnose their patients and saving their lives. And my message for you is, if you are suffering from anything that I mentioned, please don't think that is in your head and that you have to take antidepressants. Just keep on going and see different doctors until you get your answers. And keep in mind that sometimes wrong diagnoses can actually hurt you and damage you irreversibly. And I'm one of those people who went through that. Thank you. I'll see you during the next video.